Hi, this is Justine Calderwood from the Healing Spot Physical Therapy. Today I'm going to talk about neck pain. I'm actually in Minneapolis, Minnesota this week for some myofascial release training. I'm repeating the series with John Barnes. And I'm here with Heather Hammell. She's with Restoration Myofascial Release. Heather was actually the therapist that I saw 5 years ago when I was trying to get some relief from my headaches. So I'm happy to be here with Heather in Minneapolis repeating this series. And you want to say anything, Heather? Yeah.
Well, I practice here in Minnesota. I actually practice in Wisconsin, but I live in Minnesota. I'm located in Onalaska, Wisconsin, and I'm excited to be here. I don't always hang out on Facebook in my bra and shorts, but I'll do anything for Justine. So here we go.
So today we're talking about neck pain, and so I just wanted to quickly kind of give you an idea of other areas to look at that you might not even be aware that your neck pain might be coming from, and then I'm just going to go over a little bit about how we treat it from a whole body approach using myofascial release. So Heather, I'm just going to have you face that direction. So first thing I do when someone comes in is I always look at the posture, okay? Where is your body at? How is it being pulled out of alignment, out of that center of gravity? So I look at you from the back side. And with Heather, her left side's a little bit forward, her hips up a little bit high on the right side. I'm going to have you go ahead and face toward them. So one thing we look at with this is just, again, where are things being pulled out of alignment? And you can maybe appreciate, that things aren't level here. So if all I ever look at with neck pain is the neck, then I've looked at Heather like this, okay? I've missed everything else that her body can be telling me through my eyes and also through touch. So one thing that is often ignored with neck pain is looking at the front of the body, okay? So again, we look at it through the shoulders, maybe the front of the neck. I'm going to start here at the hips, so go ahead and face that direction. Okay. So if you have this tilt in the hips where maybe your hip flexors right here in the front are tight, it's going to pull you forward like that, and it's going to make your back arch, okay? So you may not think about neck pain. If your back's not hurting, you might not even think that it may be coming from your hips or your back. So that's one thing. What happens with that, if you're in that position from sitting too long, or having just tight hip flexors, what it will do is actually start to pull from the front into this chest area, okay? And it starts to create, it can create up to 2,000 pounds of pressure into the soft tissue, pulling you forward. And what will happen there, your body may start to even pull forward like that, but we have this self-correcting mechanism. Our body will compensate because we know you can't walk around like that. Some people do, unfortunately, but your body will do as much as it can to tilt that head back up, okay? And it can start to create a lot of tension and tightness into the suboccipital area right here where your head and your neck meet, okay? And so that's where a lot of people have the source of pain, but really it's coming from, can be coming from all of these restrictions in the front side. So what do we do about that, okay? Heather, go ahead and lie down. So I'm going to show you just a couple approaches that I use, or a couple techniques that I use. Now I'm going to go through this pretty quickly because I'm just trying to show you some quick information. But in actual treatment, I would have spent more time looking at things. I will definitely have spent more time holding these releases that I'm about to show you, but just to give you an idea, okay? So during treatment, it might look like, if I notice that there's some asymmetries here in the shoulders or some tightness through the pec muscles or into the chest, it might look like something like an arm pull. So I might take her arm like this, hold on to it, and I'm creating some traction through the arm, and I'm feeling for those restrictions in the soft tissue, and I'm waiting at the barrier. So I'm not pulling her arm off, I'm not forcing anything, but I'm waiting for her body to start to respond to that pull. And then I would work on, going up and around into certain areas where I'm feeling those restrictions and waiting for her body to soften and melt and let them go. Because again, it can put up to 2,000 pounds of pressure in through pain-sensitive structures in the body, like nerves and muscles, bone, that kind of thing. Okay, so that's one thing. Again, I'm going very quickly. I would spend way more time on this during actual treatment. Again, if there's tightness into the chest, it might look like something doing what we call a cross-hand release, but coming from the front side here into the shoulders and the chest, pressing down very gently, just again, until I meet that resistance. And then I'm pulling my hands apart and I'm waiting. So I'm trying to open up this part here so her shoulders aren't rounded forward and creating a lot of tension and stress in the front side. It might look like something like this, where I'm coming underneath and using my finger pads right into that area called the suboccipital area. And I'm using my finger pads to get into that area that can be painful, but very restricted, okay, causing some of the cervical extension, okay. They might do something like some traction, where I'm just very gently holding onto her head and, you know, lifting up this direction. So I'm creating some space in between the bones in the neck, okay. Tightness in the hip flexors, it might look like doing like a cross hand release here over the hips. It might look like doing some leg pulls. So I'm lengthening out there and creating some space so we don't have all of this pulling her forward. So anyway, that's in a nutshell kind of what I would look at as a physical therapist, what I know Heather looks at as a massage therapist using myofascial release approach, looking at that as a whole body, what could be happening and what can we do to help our patients, our clients feel better. So did you want to add anything?
Just keep in mind, you know, this work, it's an ongoing thing, and there's so many areas where you could be holding tension. So it's so important to get to that myofascial release therapist, whether it be me or Justine, or, you know, finding someone on the directory and, you know, getting treated. It takes more than once.
Yep. All right, thanks for watching. If you do have neck pain, just reach out, okay? We'd be happy to answer any questions. Bye-bye.